joined with us now virtually, we have Fred Benzavengo, who's the Senior Director in Pharmacy Operations over at Giant Eagle. We're also joined alongside Dr. Leah Smith, who is a pharmacist and medical educator at GSK. Welcome to both of you.
Thank you so much.
Okay, as we know, the holidays are here. There's no better time to focus on your health than now. The gift of health, it's something that, is fleeting, something that we should hold very close to our hearts. When we look at the importance of the shingles vaccination, this is something that pops up in, I guess, more of the elderly population. What do you guys typically see with this, and why do you recommend the vaccine?
Well, I'd like to take a step back and just start with the basics if we can. I'd just like to talk about what shingles is for people that might be confused. So just simply put, shingles is a condition that's caused by a reactivation of the same exact virus that causes chickenpox. And so what happens is after you have chickenpox as a child, the virus just lays silent in your body for many, many years. And then as we age and our immune system declines, it can reactivate, and that's what causes shingles. So it usually starts as a rash on one side of your face or one side of your body that begins as a blister, and then it might scab over, and it could take several weeks to heal. But many people describe the type of pain that comes along with shingles as like an aching or burning type of feeling. And in about 10 to 18% of people, that pain, unfortunately, can be long lasting, and it could last several years after that initial rash.
Okay. What typically causes the shingles virus to appear in someone?
Yeah, no,
What
that's a really
triggers
good
it?
question. Right. Well, so there could be a few triggers, right? Stress could be a risk factor or a trigger for it, but the most important risk factor is age. So like I said, as we get older, no matter how healthy you might feel, no matter how active your lifestyle is, we can't avoid aging, right? And so your immune system just begins to weaken. And as your immune system weakens, it allows that virus to reactivate. And so a lot of people may not know that 99% of people who are 50 years of age and older already have that virus that causes shingles inside. Even though not everybody who has the virus will go on to develop shingles, that is what is the major risk factor, is your age.
Okay. What kind of questions should we be asking our local pharmacists about shingles?
Yeah, I think you started off the interview and hit the nail on the head. We're in the holiday season. We're spending a lot of time planning. What are we doing for the holidays? What games are we watching? What meals are we eating? What are we doing afterwards? Part of that planning should definitely be, what can I do to prevent or to protect myself against some of these vaccine preventable diseases. So the easiest way to do that is just to stop in, talk to your physician, or stop into your local Giant Eagle pharmacy and talk to the pharmacist. And they can guide you on, answer your questions on risk factors and things you can do to prevent shingles and many other preventable diseases.
So this is something, if you've had chickenpox as a child, you want to get the shingles vaccine.
Well, it's definitely a discussion you want to have, right? Everybody's situation is different, but if you've had chickenpox and you know that for a fact, even if you don't know and you're in that group of people who are 50 and older, you may have the virus inside of you, even if you don't know. So that's why it's important for you to have those discussions one-on-one, so everybody knows your particular risk factors in your case and can think about the right decision for you.
Okay. No, that makes sense, because a lot of people my generation would have had the chickenpox vaccine. So then now, right, it kind of takes care of that for itself. Or if you've had chickenpox, you're in the clear.
Well, I do want to say, even though, yes, people have had the chickenpox vaccine, again, talk to your doctor or pharmacist, because according to the CDC, that does not 100% prevent you from potentially getting shingles later in life. So a lot of factors at play, which is why you really want to have those discussions and ask the questions, like Fred said, and don't make any assumptions about your particular risk.
Okay. Where do you think is the best place to go as far as a resource to learn more about the risk for shingles?
Your physician, your local Giant Eagle pharmacy, or if you don't want to leave the house, you can also visit easyvax.com, and that will give you the information about all the vaccines available in your area.
Okay, that sounds good. What are some of the biggest misconceptions that you guys hear about shingles? I'm sure you hear a lot.
I'd say the biggest one is that people think they're not at risk, right? So I cannot reiterate how important it is for you to just learn what puts someone at risk. So, there was a study that was done in 2023 by GSK that found that up to 86% of adults were just completely unaware of how shingles might impact them. So I think during this holiday season, really any time, it's a good time for you to learn about whether you are at risk.
Yeah, best to just keep yourself protected. And thank you both for your expertise. Of course, you can go to easyvax.com or head over to gianteagle.com to learn more. We appreciate your time and spending it with us this morning.
Thanks so much for having us.
Thank you.